Script. Have you ever pondered the question, when did we begin to acknowledge and address gender care for children? The journey has been long, complex, and undeniably controversial. In the early days, the concept of gender care for children was virtually non-existent. The binary view of gender, male and female, was the accepted norm, and any deviation was often met with confusion and unfortunately discrimination. Yet, as society evolved, so did our understanding of gender. As the 20th century progressed, a shift in understanding began in Western societies. The concept of gender identity started to be recognized, marking a significant step towards gender care. It was a time of gradual acceptance that gender is not strictly tied to one's biological sex. By the late 1980s, a medical intervention known as puberty blockers was introduced. These medications, initially used to delay early onset puberty, soon found a place in gender care. They offered transgender youth a chance to pause the physical changes of puberty, providing time to explore their identity. Fast forward to the early 21st century, and gender care for children had become a recognized field, with specialist clinics offering a range of services from psychological support to medical interventions. The American Academy of Pediatrics and other medical associations endorsed gender-affirming care, including puberty blockers for transgender youth, signifying a significant validation. However, the journey of gender care for children has not been without its challenges. Recently, in 2024, the National Health Service of England made a landmark announcement. After a public consultation and independent review, it decided that children would no longer receive puberty blocker prescriptions except those involved in clinical research trials. This decision was based on a lack of long-term evidence on the effects of puberty blockers despite their widespread acceptance since the late 1980s. This decision has sparked a heated debate. While some government officials support the move, LGBTQ+ advocacy groups have criticised it. The NHS plans to conduct a study on puberty blocker use by the end of 2024, a move that could reshape the future of gender care for children. In summary, the evolution of gender care for children has been a journey marked by advances and controversies. From the early acknowledgement of gender identity to the introduction and subsequent limitation of puberty blockers, the field has seen significant changes. The recent decision by England's NHS highlights the ongoing debate around the use of medical interventions in gender care. As we move forward, it is crucial to keep the conversation open, respectful, and focused on the best interests of the children involved. Now, more than ever, the need for clarity, understanding, and evidence-based approach in gender care for children is paramount.